We need more data to be able to make informed decisions, informed choices. But Dr. Rao, let me come to you on the issue now of boosters. There is consensus between both Dr. Jayadevan as well as Dr. Pandit that boosters will be needed, at least as far as protecting the healthcare workers who were the first to actually get the vaccination, as well as those who are immunocompromised. Now, what global data seems to suggest is that the mRNA vaccines are offering better protection. And if one goes by what the preliminary evidence suggests, then the AstraZeneca vaccine, which is Covishield, which is bulk of India's vaccination program, may not necessarily be as effective in dealing with Omicron. But to Dr. Pandit's point that we're still dealing with Delta, we don't have the mRNA vaccine in India. So should we just forget about that and go ahead with an additional booster dose of either Covishield or Covaxin, whichever is available?
Yeah, thank you. I think I'm in consensus with both Dr. Pandit and Dr. Rajiv that there seems to be no ambiguity on the discussion that booster dose seems inevitable for a reminder to be given to our immune system at this juncture. I think what's more relevant is if you look at the UK NHS, if you look at the USA CDC, all of them are of the opinion now that if you have crossed 6 months, your immune system may require a reminder to give a jump to the antibodies, and that could additionally give protection. Now, the data for this comes from the data that has been started with Israel starting the booster dose in the real life evidence to many other countries that are now showing it, including UK. What's most relevant at this juncture to understand is that with the way that the race between the vaccination and the variant is, that vaccination somewhere would need to take an edge, and the immune system will require another reminder, which possibly is what is happening right now. And another point that we are to also remember is that it's also the time of the twindemic, wherein you are seeing a rising flu incidences along with that of the COVID, which seems to kind of give an ambiguous picture about the entire evolving pandemic. So at this juncture, the frontline workers definitely ought to be prioritized for the third dose. You know, there is an ongoing debate world over about the 3 for me and none for you debate, which talks about vaccine inequalities across the world. And that's something that every country is cognizant of, and WHO is reminding every country to say that please conserve your doses and use it very diligently while making the world a safer place, because the next new variant may come from a country or a state which has got very poor vaccination. So I think a lot of factors are right now in place, but data obviously pointing out to the fact that a third dose is useful in giving your immune system a reminder to enhance its antibody responses and be prepared for a new variant.
Right. So I think consensus on this panel that a booster will be needed. It is inevitable, in Dr. Rao's words. A reminder is required at this point in time, especially as far as healthcare workers and the immunocompromised are concerned. But Dr. Jayadevan, I want to come back to you now and talk to you about what you're seeing specifically in Kerala. As you pointed out, that a vast majority of those who are suffering from COVID and, in fact, severe cases are the ones who fall in the non-vaccinated category. But Kerala continues to throw up large numbers. The daily national addition continues to be largely driven by states like Kerala and Maharashtra. So you have a highly vaccinated population, and yet you're seeing transmission continue. What does that tell us?
Well, we have looked at the data from Kerala, specifically comparing the vaccinated and the unvaccinated individuals. The unvaccinated individuals have a 10 times greater risk of picking up an infection and a 17 times greater risk of, unfortunately, dying from COVID-19. And that's the data from here. Now, you know that Kerala had shielded quite hard in the first half of the pandemic, which means that the majority of the population escaped what we call natural infection. So most of Kerala's immunity, or a large chunk of Kerala's community immunity, is through vaccination. So as was earlier pointed out, I think we should really focus on what's called hybrid immunity in the long run. I'm talking long run here. Dr. Vishal very rightly talked about the race between vaccine and the variant. That is so profound. But I can tell you, with all our efforts here, I've been chairing COVID meetings ever since the pandemic started for 2 years, every Tuesday. Next meeting is tomorrow. Now, we've been carefully watching data that's evolving from the ground. I can assure you, there is no evidence of waning of immunity among healthcare workers, specifically about severe disease. I repeat, people are not picking up severe disease or dying. Yes, we picked up breakthrough infections back in March and April, and they were published also from Kerala. So we know that breakthrough infections, which is infection of the nose and throat, will continue to happen regardless of what vaccine you take, whether it's mRNA or inactivated or adenovirus. And that's a fact. And that will continue to happen even among boosted people. We know the report from South Africa where 7 individuals traveled from Germany to South Africa. Some of them volunteered in the hospital, and all of them were recently boosted, and all 7 of them picked up symptomatic Omicron. So we must be very careful about how we pick up, how we choose the so-called boosting programs. I do not endorse boosting everybody. I think, as Dr. Rahul correctly said, there are a subset of individuals who are more likely to develop a bad outcome. And I totally agree that somebody with a compromised immune system must be given the benefit of a 3rd dose. I would be reluctant to use the word booster there. And in other individuals who, for whatever reason, are at increased risk compared to somebody else. So I'll end with an example of a urinary tract infection for our viewers. We know that for a healthy young woman with a urinary tract infection, if you give a baseline antibiotic like trimethoprim for 3 days, it will be enough. Suppose, for argument's sake, I say, look, why don't you give 10 days of antibiotic? It may give her greater protection. And for a hypothetical argument, I say, look, give everybody antibiotic and prevent infections altogether. To somebody who does not understand medicine and public health, both the arguments may sound logical. And that's why it's important to look at these decisions with a very impartial mind, look at data, and then come with customized conclusions which are important for the nation.
So just to take that point forward, and I appreciate you trying to explain that to us in layman's terms. So what should the customized solution be for India currently in terms of where we stand, in terms of the availability of the vaccine and where we are in the course of the pandemic?
What India lacks as of now, the deficiency we have as a nation is published data. We don't have a large series of published data, at least in the public domain. It's possible that experts may have it, but it's not available to us doctors. So that is one deficiency we have. If we can get the data out there and see on the ground if it's corroborating with what our observations are. As I said, we are not seeing increasing cases of severe disease. We are not. So when we say customizing, we know that COVID-19 does not affect all age groups equally. For instance, I'll give you an example. If I look at Kerala data, it's out there in the public domain on the Kerala government dashboard. It says that 96% of deaths have occurred over the age of 40. And, in India, 75% of our population are below 40, which means that if we focus our efforts on 25% of our population, we can prevent 96% of the deaths. So we need to look at things like that. And we also need to understand that the older a person is, the more likely that person is to have a bad outcome. So we need to have more focus in that age group. So that is, again, where the questions of boosters will come in. And I know our choice of boosters is not very good at this point, extrapolating from the data we have. But the recent approval of the Novavax, Covaxin adds a little bit of hope in a potential choice of a booster.